Why are people with ADHD so sensitive to rejection? Where does it come from? And what are some simple strategies that you can use to help manage it in your personal life and in your romantic life? These are the questions I asked today's guest, Dr. Samantha Hiew. This is a conversation I wish I had when I was younger. Thank you so much and enjoy the episode. Samantha, thank you so much for joining us.
Oh, nice to meet you, Alex.
Samantha, I asked my community to describe rejection sensitive dysphoria, and they said, I'll get a small rejection and it'll make me feel like trash for days. I'll feel intense sadness or rage. I'll continue to think about it for months, and even years later, it might pop into my head and make me feel like trash again. Do you think that's a fair representation of RSD?
Yeah, definitely. I guess it also depends on the intensity of that reaction and what the source of the source of the challenge is. Because some rejections you can let it go a lot quicker, but some last for a lot longer. And I do find that the ones that do last a lot longer are more relationally related. Things that perhaps are said by someone who means something to us. And then we can bring it up at a later date. Because.
Where does RSD come from?
Yeah, so, the rejection sensitive dysphoria in relation to ADHD, you mean? Like that was, I guess it was William Dodson, the American psychiatrist who worked with thousands of children and families with ADHD over the years, who noticed, this intense reaction to perceive rejection by somebody with ADHD, in a situation. And the scale of the reaction can be so much bigger than the actual rejection that, he's seen that quite universally in a lot of ADHDers.
Do you think it's because people with ADHD are exposed to so many more negative criticisms when they're growing up, that they have a subconscious feeling of being different, so they're more primed to react defensively when they come across a criticism?
That's completely it. But then I tend to look at the stories of where we come from and what happened to us along the way and our current life in motion. To answer that question, I really need to look at the context. So from the very beginning, if we are born with this neurodevelopmental difference, that will perhaps, cause some challenges with the relationship that you have with your caregiver. If they also have undiagnosed ADHD themselves. So research has shown that less than 10% of ADHDers have secure attachment. And I can see the stories behind why that is, whether that is the story of, genetics or the environment or social deprivation or adverse childhood experience. So if you imagine a child who's coming into the world and they're very much reliant on the adult that, look after them in order to learn how to regulate their emotions and how to form, that emotional regulation. And so in the absence of that, or, we're not just talking about, anything that necessarily happened in an abusive way to us, but in an environment where perhaps there's neglect, where we should have gotten the support when we haven't, and then, this can cause challenges within ourselves where we're then trying to figure out how to navigate these huge emotions by ourselves. And that, if you never learn that over time, you put in maladaptive strategies, in your life whilst contending with a world that you're trying to fit in. And, if you are receiving so much more negative messages because of the way you do things and the way you are, whether it's because of the executive functioning challenge or emotional regulation or relational issues and problems, then you are less likely to have really learned how to get over your past or to deal with emotions, if that makes sense.
Do you think people with ADHD are more susceptible to rejection sensitive dysphoria?
Yeah, well, I suppose you have to see what this rejection brings up in us, right? Because we would navigate the world as human beings anyway. We navigate the world through our nervous system. It's our nervous system that has embedded memories from the past. And when we encounter a similar situation, then your nervous system will flare up in the way that it's always known how. And a lot of ADHDers have a poor relationship with stress. And when we have that, then if there is a trigger where there's a relational injury, tends to bring that up more because of that insecure attachment piece. And it can land us into a state of hypervigilance where we're hyper anxious or hyper acting up, or dissociative where you're, internalizing things. And so when these triggers present in our day-to-day as a form of rejection, we will experience it, and then our nervous system will decide which route to go. If you externalize it as someone who's always prone to that fight or flight, then it can come out as rage, anger, relational challenges and problems and breakdowns, maybe withdrawing from things because you don't want to be in that situation where you are likely to be ridiculed. Whilst if you internalize it, it can look like major depressive disorder. You can be depressed because of that relational injury. Or you can, have rumination, this loop that goes in your brain on and on and on. And also the inner critic and suicidal thoughts, things like that. And often the worst type of rejection is the ones from people closest to you, where you feel like you don't have to mask or be someone else, and that's when it hurts more, because we are masking when we're at, we're outside, we're dealing with the rest of the world, aren't we?
Is it possible for the response to a criticism, the pain that we can feel, is it possible for it to be physical?
Yeah. So, there is a part in your brain that ensures that you feel that pain from traumatic memories or, past somatic triggers. There's a part of your brain that ensures you feel it in your body. When you encounter RSD, that brings up that shame and guilt, inside you. And that part of the brain is called posterior insula. And I came across this when I was going to therapy myself, and I was encountering a situation where it was a moral dilemma. And my therapist brought this up, and it actually made me think that could be why it hurts in my body when I feel rejected, because it's bringing up all the ways in which I wasn't welcome or I wasn't loved, and that is not a wound that I got today. It's from a long time ago, So when we say the reaction does not equate to the actual reality, because we're not even responding to the person in front of us or the source of the reaction, the source of the rejection in that moment. We're reacting to something that we never got over a long time ago.
So you sort of get snapped back to a past trauma from your early years?
Yeah, it doesn't have to be early years. It could be trauma in motion, because we think of trauma as just something that happened a long time ago, with our parents. But actually, a lot of individuals with ADHD, we have had to learn to adapt very quickly, think on our feet, and going into every situation and trying to adapt to be like everyone else, and that is really hard, because I think the whole hallmark of ADHD, having executive functioning challenges, you are trying to, when you're in a situation, you're trying to get your brain to engage and do the thing that it's expected to do. And the anxiety that comes from not being able to give people what they need in the moment, in every situation that you go in from the moment you were born until now, that brings on, challenges that researchers have put down to look very similar to the nervous system of somebody who has encountered post-traumatic stress disorder. I'm not saying that everyone with ADHD has post-traumatic stress disorder, but the challenges and the adaptations that you go through every day, research has shown that looks like post-traumatic stress disorder in your body.
That's fascinating. So is that because you have spent your whole life fitting in, shape-shifting, altering who you are, masking, essentially, desperately trying to be what you think society wants you to be, that constant not knowing who you are, adapting to the situation in front of you, that can look like PTSD.
Yeah, because also, whilst we're doing that, we're learning to give people the version of us that they like, the version of us that are most likely to love, to be loved and to belong. And over time, that can look like what will make other people happy, but not you. And, if that happens over a long period of time, you can be trapped inside. And then one day wake up and wonder, why do I work so hard? Why does this have to be perfect? And why do I look for validation in other people and things? At the end of the day, none of that really matters and I'm not happy. Then you're going to have to start asking yourself how to get out of all that layers of conditioning and archetypes that you built for yourself.
So interesting. So I think everyone listening will recognize and really relate to the feeling, the feeling of intense sadness or rage when they're triggered by a criticism or a rejection. And so I suppose the next question is, are there any tips to manage it? And I suppose breaking it down into immediate tips, short term, that you can do in the moment, and then also slightly longer term tips that you could do over time, working on yourself to sort of make you more stronger and resilient for when you encounter future rejections?
Yeah. So I think in order to do that, you got to look at your current environment and your context. So short-term wise, there are strategies you can do to snap yourself back into the moment. Because when we encounter RSD, we are essentially in an amygdala hijack, right? Because your body has sort of gone straight to feeling those emotions so intensely because you're unable to tap into your prefrontal cortex to think, what are you going to do about this, right? And if you want to snap yourself out of that into the here and now, you've got to focus on something that you can see and feel and hear, but it's got to be strong enough to transfer your attention from the emotional circuit into the thinking and the here and now circuit. And so in order to do that, I know that there are, some methods that DBT, dialectical behavioral therapy, people recommend it to say you could use something like an ice shard, that maybe you're frozen some fruit juice. And that takes planning, by the way. It's not something that, you just open your fridge and get. So it's part of living with ADHD is to navigate this day to day. Like, when can I enter, this amygdala hijack? If your situation is stressful, how can I help myself, with my emotions? And if you know that you're entering a stressful situation, it's useful to have something like that. So whether it's something sharp or something that tastes sharp, like the lemon juice that you share with me, and also something that's cold and maybe sweet. It's got to be something that works for you, because for me it's like cold and sweet can snap me back into the moment, but for you it might be something else. Maybe that's why so many people do comfort eating to kind of try to get themselves back to regulation. But I find the most effective way is to call a friend. And it's got to be a very compassionate friend as well. Because without compassion, we're just going to go further down the self-chastising, right? You almost need someone to reflect back the good in you and the reality of the situation, to tell you that, you're okay, what you're feeling, is valid. And then, just sharing that and maybe having someone, tell you that you're okay. And it really helps, in the here and now. Or take yourself out for a walk in nature. But say if it's long term, then we're really looking at the different parts of us that are involved during the reaction, in the rejection sensitivity dysphoria. What kind of character is brought up? What do you see when you feel rejected? Because when you externalize it, it looks like rage, right? You could end up shouting at the people around you, even though they had nothing to do with, why you feel rejected. But why do you feel like that? What is that feeling? Is it because some time ago, someone has made you feel worthless, and your compensation strategy is to work really hard to maintain that self-worth. And when there is a criticism to your work, then your self-worth is then at stake because you have associated your self-worth with how well you work and how much you achieve. And so if that criticism is towards that, the external archetype, then of course you're going to crumble, right? And part of understanding yourself is to build those scaffolding, that perhaps you never really learn how from the beginning, and to reparent yourself to understand what is it that makes you feel strong in yourself without using external, archetypes or people or things to validate you, external validation, basically. So over time, that can be done through therapy. And there's, I would always say, go for therapists that shows you compassion. And there is a modality in trauma therapy where you look at the internal family systems. And I think this is really what it is when the scale of the rejection, right, the reaction is so high, is that there are different parts at war within yourself. And there's obviously a very intense part that is very hurt and very injured. And, the internal family systems look at all the different parts of you and try and find a part of you, that truly believe in yourself in order to navigate situations going forward. And ultimately, it is really about building that sense of self and self-belief, and deconditioning ourselves from the archetypes that we have built for external validation and finding the environments for us to move forward. But, medically, there are non-stimulants that have been prescribed for RSD. So guanfacine and clonidine. People have said that when they take guanfacine, they tend to know when the rejection is coming, but they let it go more, so they don't let it get really bad or manifest. But then taking that guanfacine then helps them to build skills to navigate that situation. Over time, people have said that they don't really need guanfacine anymore, so I think over time it's really understanding, how we react to things and who we are as people.
Do you think you should share that understanding with your romantic partner? Do you think you should have an open conversation at the beginning of relationships to say, RSD is something I contend with? Do you think you should open that and share that with your partner?
Yeah, in a new relationship, I think it's a good idea to say that you are quite a sensitive person, especially when we talk about this, and this, But I would always say, God is fair, right? What they give us and what we perceive as a negative, it can be a good in other situations, So what makes us bad in this situation can be what makes us good in other situations and contexts. So I always believe that we attract people who reminds us of the part of ourselves that need to heal. And if, we are attracting people because we are sensitive to rejection, but also sensitive in nature, that sensitivity is also a strength when we look at how we can be empathic, to other people and individuals who have ADHD. They tend to feel things in their body rather than, have empathy through, thinking. So it's having empathy through what we feel for others in our body. And so if we're able to be this person that, have that level of empathy and nurture for somebody, and they see that as something that they want in their lives, to have in their corner, then, dealing with us when we're feeling, a sense of rejection to something that is said or, in a day-to-day, that is a very small exchange, I think, for the good that you're getting in us as well. So basically, I'm just saying that what makes us bad makes us is also what makes us good, and it's to be balanced in our discussion with our partners as well.
So true. I think the bits that might cause the issue in the relationship, the rejection sensitive dysphoria, is a small price to pay, because the part of them that causes that reaction is probably also the part of them that creates all the fun and exciting and the spontaneity and all the amazing things that you fell in love with that person for. So it's kind of like a balance, and that's the negative, but there's also all of these positives on the other side.
Yeah, exactly. And also, we all have strengths and challenges, right? So it's not just us, it's the other side as well, Maybe we're just better able to talk about it because we have the words and awareness about it now. But, the other side also, have stuff, and hopefully that they, are aware enough, to contribute to this conversation. It's not just all about us, you know what I mean? So then we don't just hyper focus on these big challenges that we have when actually you bring some stuff too, Come on. Right?
When I asked my community that I was going to be speaking to you today about rejection sensitive dysphoria, and the main question I got was, please, can we have some advice on how to manage RSD in relationships? And I know we've just touched upon that there, but do you have any other headline advice that people might find useful in navigating RSD in romantic relationships?
They say a lot of the mental health challenges that manifest in our lives is caused by the relationships that we have. And I do believe that it's our closest relationships that brings out, that in us, because we're going back to that internalizing RSD and externalizing RSD and what that creates. So it's either that rage, outwards, or dissociative inside. And this can look like argument patterns in relationships. Some of us might be the type of people who need to discuss it there and then, right? We are more kind of tackle it now because I need to talk about things, and you're externalizing, right? But then the other person is I'm just going to mull over this and just keep it all inside for a bit as I process. We're talking about different processing style as well. So it's useful to understand what kind of partner you have, what their neurobiology is, which is a bit complicated. But, just to understand what is their level of emotional maturity and how they handle stress, Because sometimes when you talk to somebody, you think they're talking about you when you're arguing, but actually they're arguing with their own mother, and they're seeing their mother in you, because maybe some people have that challenge, from the past where they haven't really resolved, the pain that they felt from their mother. And then all of a sudden you're carrying that burden going forward. So how important it is for you to know before you get into a relationship what you're getting into. Is that person really going to be worth all the investment? Or, are you able to help each other grow? In order to do that, you both need to be self-aware. You both need to be emotionally mature, because if you don't have that maturity, or if the other person doesn't, then how are you ever going to make it work unless you sacrifice, a part of yourself? Because Gabor Mate talked about this in his book, The Myth of Normal. We are trying to reconcile between authenticity and attachment. So if we're attached to somebody that we're closely related to, whether it's our partner, our long-term partner, or someone that we harbor dreams and hopes, for the future. And sometimes when conflict happens, we might think that if I tell you what I need truly, then I might not be able to stay with you because maybe somewhere deep down, that they don't have the capacity to handle all that. And isn't that true for us ADHDers? We believe that we are too much for certain people, and we've got to hide a bit of ourselves, because if you really see us for who we are, then are you really still going to be there and love us? And why not bring that all out on the table? Not as a way of pointing fingers, but as a way of looking at, this is the person that you're going into a relationship with. But how many of us actually ask these questions, right? In the beginning, when it's all very woozy and beautiful. And then as you settle in, this little conflicts start to happen, and they're micro conflicts, micro situations that might build resentment or might build love, But it can go any which way. The important thing is to communicate about it. But in order to do that, you need to have maturity. And in order to have maturity, you need to work on yourself and really own your shit as well. Because if you're just looking at other people bringing you pain to your life, that's not true, because we're also contributing to pain, if it's happening, is rolling in motion, because, relationship is two ways.
You're fascinating. And you mentioned earlier about often people with ADHD, in response to an RSD flare-up, can often be labelled as like too sensitive. And do you have like a counter to that if your partner or anyone says stop being sensitive when you're having a real episode? What would you say in that situation?
Yeah, I think knowing how my brain works right now, I won't see that as a criticism. I see that as a compliment, because a long time ago, I had to figure out what is it that I bring, that no one can replace me. And I bring a lot of empathy to every situation. And this empathy is mixed with emotional and cultural intelligence. And so the answer to that is to use that as your strength. We are sensitive. What we have inherited isn't just a nervous system that is, prone to stress or executive functioning challenges. We have inherited increased sensitivity to the world because we hear more, we see more, we feel more, and with that, it helps us see the things that no one else is seeing. It helps us empathize, and fight for people we love, because we will not leave them behind, and we will be loyal, and these are the things that anyone would love, in a relationship. But unfortunately, with this, then comes with great powers, come great responsibility, and that responsibility is to manage the emotions. But it's a growth process, and it starts with awareness, compassion, and then maturity, which needs work.
Such good advice. You said something fascinating before we started filming today. You said that when women go through the menstrual cycle and men go through the daily testosterone cycle, that can affect how they respond to criticism. Can you explain what you meant by that?
Yeah. So I'm looking at the oscillation of our sex hormones. So the changes that happen, when in the month, our sex hormones are higher and lower, and for both men and women, except that for a woman, the changes happen over the course of the month, so it's cyclical, whereas for a man, it happens on a daily basis. So for a woman, I liken it to having 4 seasons of the year within the month, and that is spring, summer, autumn, and winter. And that is distributed to different phases of your hormonal cycle. So when I'm in the spring and summer, I'm really happy. I'm going towards ovulation, and I'm verbally very articulate, and I sleep better. I have more energy, more able to regulate my emotions. This is the best time for me to give a talk and, to have constructive arguments, without really taking too much to heart. My mental health is in a better place. But take me towards the autumn and the winter, going towards luteal phase, and I have trouble sleeping, because with the decrease of estrogen and increase of progesterone and decrease of acetylcholine and serotonin, what is impacted is my well-being. I'm feeling less happy because there is a chemical change in my body, and I'm also less able to sleep and less able to be verbally articulate, and I don't remember as much, which means that my day-to-day might be a bit more chaotic. And so when you put that context into then navigating rejection, whether it's like work or whatever, it feels like an extra atom bomb thrown on top of a detonation, So there is really so much that I can take in that time, and if we are aware of that and we can educate our partners about it and maybe tell our work, when we need a duvet day, because apparently some countries have that. And actually some countries have menstrual leave. Spain has just legalized that. And so that helps us a great deal because we are dealing with our biology, which impacts our psychology. Whereas for a man, your oscillation of testosterone is happening on a daily basis. And actually, by the way, this happens to women as well, except that we have lots of backup sex hormones to, help ourselves. But generally, testosterone goes up in the morning, and that's when you feel vitality and happy. You have more energy, and you're tackling the day. Whereas this goes down as the day goes by. The day goes on, and your testosterone dips around 5 or 6 o'clock. And that's when you would try and eat before that happens and maybe go to the gym and exercise because that brings up the testosterone level as well. And so it's so important we understand that because if you are taking medication for ADHD and you need to, understand that there is a part of the day where your medication will start to taper off and your blood sugar will start to crash alongside your testosterone going down and you haven't had your dinner, then that is when you're likely to have arguments with somebody and they might say something that will incite an RSD. But not knowing that, people are unwittingly going into situations that really is quite harmful to themselves and their relationships.
It's so fascinating. So there's an actual chemical reason for a man to react differently to rejection throughout the day, and a woman, and a chemical reason why a woman might react differently throughout the month. And then if you zoom out, actually throughout her life, depending on where she is, menopause, premenopause, post, with talking about the chemicals, and from my experience and with speaking to others, if I'm hungover, for example, after I've been drinking alcohol, I find that I'm much more susceptible to a flare-up of RSD. Is alcohol have a big impact on the levels of dopamine and serotonin?
Yeah, 100%. Because you're not just looking at the neurotransmitter levels, you're looking at the impact of alcohol on your sleep and how that helps you navigate stress. Because research has shown that once you had a glass of wine, that decreases your sleep, your deep sleep level by like 20%. And then once you have like 2 or 3 glasses of wine, that goes down by 40%. So your sleep quality is affected, which means you're waking up the next day more grumpy because you are groggy, your body is lacking the vitamins and minerals that it needs, to feel balanced, and a decreased ability to handle stress. And so anything that happens then means that you have less ability to handle that emotionally. Of course, you're also looking at other areas of your life, like, is this something you're doing every week? Or is it a one-off? Do you have protective environments that allow you to recover, or protective relationships that allow you to just lie in bed, and watch Netflix through the day and you're fine, you recover and then, you don't need to have harm yourself or anybody. But most of us don't have that, right? Because we live with people if we're lucky. And we, so we're going to look at other contexts. But generally, research has shown that alcohol is the most destructive drug when you put alongside MDMA or LSD, alcohol being culturally accepted as well. Is something that a lot of people use as a crutch for social anxiety and, just to help themselves feel more confident in situations, which, unfortunately is I'm going to say I feel like a party pooper when I say that because I have gone out with my friends and I know that, it will help me loosen up as well. But then I think too much about the consequences that I'd rather be awkward for 2 hours in order to not suffer the next few days,
Do you think there's a way for someone with ADHD to differentiate an irrational reaction to criticism or rejection against a justified reaction to criticism? In other words, is there a way for someone to tell if they're having an RSD flare-up, which is irrational, or are they having a genuine, justified reaction to someone being an asshole?
Yeah, I hear you. I think when you're seeing yourself, it's interesting because it's almost like you're stepping aside and someone else has gone into your body, and just in the moment where you have that, if you're externalizing it, that anger is so big and it doesn't make any sense. And also at times it's channeled to people who didn't even cause you that pain in the first place. And then when that has happened, you feel that shame, right? Because if you are hurting so much, your immediate reaction could be, I'm going to just show somebody how much it hurts by hurting them. And it really doesn't make any sense, but it helps people feel better. But that's not good because sometimes the skill of that reaction can cause harm. And that's when it's totally unjustified. When you're, going through this pain and you're letting it out on somebody who is quite innocent, is an innocent bystander. So really, it goes back to working on yourself because they don't deserve it. And then you feel more shame as a result of that, right? And then if you internalize that RSD, then you start telling yourself, well, there's no place for me here, but you also know that, why am I saying that? Because actually yesterday I was feeling fine. Pretty sure tomorrow I won't be that bad. But in that moment, you're like, this is not right, and then you got to develop that self-questioning. I know we have voices anyway. I don't know if you do. I do. We all have different parts, by the way. I don't know like who doesn't, but I do. And there are different voices telling me sometimes I'm all right and sometimes I'm not. And why is it I'm not all right? And that goes back to the work we do in analyzing the different parts of ourselves, and try and integrate them,
You said something fascinating, which I wanted to mention. You said if ADHDers, and there was a study on this, that if we're sort of left to live in nature and out in the wild, the traits or the struggles that we associate with ADHD decrease. And I imagine, therefore, the RSD response might decrease. Could you explain more about that?
Yeah, so there is, I was looking into this whilst I was looking at our relationship to stress and trying to work out, is that chicken and egg question? Were we stressed first before, do we have a genetics or, biology that predisposes us to stress, or the other way around? Because a lot of us need a lot of stress in order to get into motion and get motivated, because that's how we learn to work and, to kick into gear. But if you take away the stress from the day-to-day, and I'm sure if we are in a position to take ourselves away from the rat race and the day-to-day, you have in your life benefited from times when you're able to unplug and be a more patient version of yourself. When you feel that, with the right elements involved and, with nature, with good nutrition and, with less stress from the outside world, your ADHD isn't as bad, right? So that research was looking at how when you take someone in nature for 2 weeks without their cell phone, their ADHD traits miraculously disappear, and that is not the case in the capitalist world, in the modern day-to-day, when we have demands, that are coming from the outside world, but also a lot of it come from ourselves inside, so there's definitely an element of being mindful about the amount of stress that's coming into your life, and how that impacts your ADHD and your ability to navigate emotional stress, which is really what RSD is.
That's fascinating. Maybe we should all go camping.
I have thought about that, Alex. I actually thought that could be a really good business idea, but then I thought that I have to organize it.
That's true. Yeah.
Let's stop right there.
Probably lose interest.
That idea went away immediately.
Oh, Samantha, just finally, I think we should do the washing machine of woes. And I think we've got a rejection special this week.
Okay.
Every week I ask my ADHD community to send me a woe, which I throw in a washing machine, because people often forget their laundry. Do you forget your laundry?
Oh yeah, definitely. I forgot. I left my heating on and my lights on and I left. And I missed the train, by the way. So
you did today. You missed it.
Yeah.
It would be. I wouldn't. I would doubt your diagnosis if you were.
No,
here
yeah.
on time.
Don't worry about that.
Let's see what the woe is this week. When I get a rejection, I'm not trying to be mean or hateful. Sometimes it's just so painful that I can't handle the big feelings, and I get angry like it's a defense mechanism. It doesn't have to be a big rejection either. A friend could simply say they're too busy to see me, and it feels like I've been punched in the stomach. It's unbearable. Do you relate to that?
Yeah, well, in a opposite way, I think I would be quite glad to, have a friend cancel on me because, I mean, for me, I don't take it personally when a friend does it because I've gone past the point in my life where I rely on friends as a validation. And that's where I see that the reason we feel sensitive to someone saying no to us is because we have put our self-esteem outside of ourselves, and we need to validate it, whether it's true, someone else liking us, and that's why the people pleaser, or, someone else loving us and someone else think we're capable and achieving and, important, which, is the other part of the perfectionist, high achiever type of archetype. Or, someone finds us funny, that's the class clown archetype. And so on. There's loads of different versions of ourselves floating outside of us that is not inside. And so if we're always relying on external factors to keep us happy and balanced, then we're in for a really unstable time. Then really, if you have a relationship with someone who has that, then you're also in for a really unstable time. So really, when you come together, in a relationship, I think the most important thing that you need to work on is awareness, of where you are at, in your emotions and how mature you are in handling things. And can you, treat a situation that maybe in the past you perceived as a rejection, but can you treat it as a way of learning? Either something about yourself or something about your partner, and could you communicate in a way that's mature so that you can both, overcome that and grow from that? And I know this context is more for friendship, but for me, I won't be as effective to a friend, but maybe more for, a personal relationship.
Yeah, no, it's so interesting. And how, I suppose, it highlights as well how minor the trigger can be, minor the event. For example, the friend being too busy to see, but there's probably a completely justified reason why that person's too busy. Maybe they're at working or they've already have an appointment and they've said no. So there's probably a justified reason. But when you're in that dysregulation, it feels like an attack, like a real like a rejection. So you really feel it. Yeah,
exactly. Like I think if we can tell ourselves that when someone doesn't want to see us, or if they are saying other things, that affect the relationship, that is more a reflection of where their friend or that the other person is, in their own personal journey rather than us, and I think if we can separate that, then we won't take things so personally,
Yeah.
But it's a journey for sure.
Definitely is. Samantha, I've certainly learned a lot talking to you today. I'm sure the listeners will learn a lot as well. So thank you so much for your time.
Oh, thank you for your time. You've been so generous. It's been so lovely talking to you. Thank you.
Thank you, Samantha.